name is Stephanie Whiteman, and I am one of the project leads for the Caribbean Youth Call to Action campaign. And again, I would like to welcome every single person joining us today for our webinar proceedings. The theme for today is looking back to move forward as we reflect on the call to action and its impact, as well as our next steps moving forward. Moderating today's session alongside me is Norgia Grant.
Good morning, everyone. My name is Norgia Grant, and I am a Healthy Caribbean Youth member. We are excited to have you all in this webinar with us this morning. While we wait for everyone to join, we would like to get to know our participants, so please feel free to enter in the chat your name, your country, your organization, if you have one, and an emoji just to let us know how you're feeling this morning. Quick housekeeping before we officially begin, please keep your mics muted. If you have any questions, use the chat and Q&A function. We will have a Q&A segment at the end. I will now like to welcome Dr. Karen Seeley, who is a member of the Healthy Caribbean Coalition Board of Directors, to give some opening remarks.
Thank you very much. Thank you very, very much. Welcome, everybody. It's my pleasure to welcome you to this webinar that's being hosted by the Healthy Caribbean Coalition's youth arm. We now fondly call HCY, Healthy Caribbean Youth. The webinar, as you've heard, looking back to move forward, Caribbean youth mental health is a reflection on all that has been accomplished since the launch of the Caribbean Youth Mental Health Call to Action on World Mental Health Day last year in October. Mental health has been recognized as an integral element of overall health and well-being. However, generally, I think you would agree that generally it gets limited prioritization and promotion in national health agendas. The COVID-19 pandemic exposed significant gaps in our policies and healthcare and social systems to support mental health. As a result, the mental health and well-being of several groups in our population was affected. Those including health and frontline workers, young women, young people, people living with pre-existing mental health conditions and non-communicable diseases, NCDs. Also racial and ethnic minorities and people living in conditions of vulnerability were particularly impacted. In light of this, youth from Healthy Caribbean Youth and across the Caribbean region embarked on this journey to advocate for and encourage more dialogue and action by regional policymakers and the public around the mental health and well-being of our children and youth. Under the slogan, "There's no health without mental health," the Caribbean Youth Mental Health Call to Action took the region by storm, and I can verify that. It garnered regional support from government officials, youth organizations, UNICEF Jamaica, the Caribbean Public Health Agency, as well as several other international organizations such as the Pan American Health Organization. As you will hear shortly, the Healthy Caribbean Youth and their allies aim to take this call to the highest of levels by engaging with technical officers and relevant ministers in varying departments in Barbados, Belize, the Bahamas, Jamaica, and Trinidad and Tobago. That's just the start. The call to action was also amplified through social media campaigns and other activities by the generous support of the NCD Child Seed Grant. There is no doubt that the strategic efforts to ensure that call to action reached far and wide contributed to it being recognized in an article in the Lancet Regional Health Americas Journal. This article called the call to action a noteworthy community-based response to the pandemic and highlighted it as an example to reiterate the importance of involving community stakeholders in all mental health promoting efforts. And I would add, in all health promoting efforts. There are many lessons for us all to learn from this call to action movement to inspire our own advocacy efforts. One important lesson to be acknowledged is acknowledging the power of youth-driven advocacy. To all who were a part of this process, especially the youth, congratulations. There are not many people who can say that they have been part of a movement like this. Your efforts have been written into history. To all of us as allies, we need to continue to create spaces and opportunities for youth to use their passion and create change. Beyond the webinar today, the Healthy Caribbean Coalition looks forward to amplifying the issues and solutions noted in the call to action in a couple of ways. One way we have done this is by highlighting mental health in our policy paper titled NCDs and Mental Health in Small Island Developing States. This policy paper was prepared with the aim of informing the outcome document for the upcoming WHO SIDS Ministerial Conference on NCDs and mental health in June 2023. So please look out for that. We will also highlight mental health services in the HCC Asks in the lead up to the second high-level meeting on universal health coverage in September 2023. Throughout the webinar today, you will hear about how this call to action journey has impacted many. It's been a driver of change and shifting the narrative in addressing youth mental health. I hope that you will leave this webinar feeling inspired to use the key asks of the call to action to start or continue advocating for the change needed to better support youth mental health. Let us look back to move forward. And I take the opportunity on behalf of HCCs to wish you a successful conversation today. I'm going to hand over now back to Stephanie and Yoja.
Thank you very much, Dr. Seeley, such powerful words and messages. Before I continue, I just want to acknowledge the wonderful contributions that we're having in the chat. I'm seeing so many persons from all over the Caribbean participating and with us today, and that just amplifies how much this Caribbean Youth Call to Action is actually a Caribbean-wide initiative, and evidence is that is seen from everyone in the chat. We all know that mental health is incredibly important for overall health and well-being, and setting a good foundation during childhood and adolescence is pertinent. Recently, we collaborated with UReport OECS to hear more about the youth perspective on NCDs and mental health. We received respondents from over 1,300 persons, with the majority of being youth under the age of 24. During this poll, about half of the respondents indicated that counseling and mental health services were easily accessible via their school and community. In addition, some of the main barriers to accessing mental health services were highlighted to be social stigma, negative perceptions, and privacy concerns. The respondents also indicated that they wanted their country leaders to invest more in mental health awareness campaigns and to reduce and manage NCDs within the Caribbean. With that said, I think this is a great segue into our regional mental health awareness campaign, the Caribbean Youth Mental Health Call to Action. Now, as Dr. Seeley would have mentioned in her opening remarks, the COVID-19 pandemic has really highlighted the ongoing mental health conditions and concerns and the problems within problems regarding to mental health within the wider world, and especially right here in the Caribbean. In 2020 and then in 2021, the Healthy Caribbean Coalition hosted 2 youth-led webinars that focused on mental health. And it's during those webinars that our youth, our students actually engaged right now with, during the COVID-19 pandemic, really highlighted some of the concerns that they were experiencing. Some of the main concerns that were highlighted during these webinars, Daniel, go next. Some of the main concerns were the need to have mental health prioritized within the schools, the need to have a really supportive environment, as well as to have equal investment for mental health and physical health services. They also highlighted our children within our youth, within our Caribbean, also highlighted the critical role of having them advocate for change, to having a more holistic approach, and as well as they highlighted the disruptions that were made with regards to accessing medications and treatment for services living with NCDs, as well as pre-existing mental health conditions. It was through these concerns that the mental health call to action was built. So fast forward to 2022, we developed a mental health call to action subcommittee where we hosted various consultations across various sectors and countries. We really needed the call to action to be a multi-stakeholder and multi-sectoral approach to really have ownership on it as young persons within the Caribbean and as well as throughout the Caribbean, and wasn't just focused on one specific country. We hosted virtual consultations from January to August, and we also got technical feedback from our regional partners such as PAHO, UNICEF Jamaica, as well as CAFA. And we had input from students and teachers, youth advocates, national youth organizations, persons living with NCDs, persons living with mental health conditions, civil society organizations, as well as private sector as well. In addition to that, we also ensured that our call to action spread across, we got input from across the Caribbean, from as far north as the Bahamas to as far west as the Belize, far south as Guyana, and everywhere in between. And through this, and you can see it in our chat as well, we really ensured that we had ownership on our document. Through these consultations, 4 key themes or 4 key calls emerged, and that was the prioritization of leadership, research, regulations, and services. Through our consultations, our youth and partners highlighted the need for the integration of mental health into existing policies and emergency plans. They also wanted to inform research to ensure that it informs mental health programming and policies. Our young persons also indicated that they wanted regulations and policies to protect children and youth from health-harming products, harassment, stigma, and discrimination. And we highlighted the need for services to be prioritized to support mental health and well-being for our children and youth. Following that, we also had the call to action really had a great symbol, and it symbolized many different things. It symbolized the prioritization of youth voices, as it was a truly collaborative youth-led approach, and it was a multi-sectoral approach as well. We really fostered a supportive environment that wanted to safeguard our Caribbean youth. We fostered greater prioritization of mental health and services, especially within the primary healthcare system. And we ensured that our call to action aligned with all of the global and regional mental health guidelines. Our call to action was officially launched in October 10th, 2022, which was World Mental Health Day. And I'm sure during between then and now, you would have seen at least one of these graphics at some point during our campaign, where we really focus on raising awareness for the need for mental health to be prioritized based on our 4 key themes and calls. From our launch, we also had a pledge, a website launch, and many other media engagements. Most particularly, since the launch of our call to action, we really wanted to engage with as many policymakers as possible, and we actually made commitment, got engagement from 5 key countries. And this was the Bahamas, Barbados. We also had from Belize, Trinidad and Tobago, Jamaica, and as I said, Barbados as well. In addition to our policymaker meetings, we also had some other initiatives where we collaborated with the U-Report poll, which I would have mentioned earlier, where we really wanted to get some feedback from youth, again, from across the region on their thoughts about mental health as a major impact within the Caribbean. And we also linked it to non-communicable disease and climate change as well. Now, this is a brief snippet, and we will engage more and talk about more about the call to action and all of the improvements, all of the progress we've made in each country later on in the panel. But in case you're itching to read more about it now while we're on the panel, you can scan this QR code or head to this link to see our beautifully done website. to read more on the call to action, sign your commitment to the pledge, and generally just show your support as well. So thank you very much, and we will continue on with the panel.
Thank you for that overview, Stephanie. It's a very necessary reminder of how much work has gone into creating the call to action and promoting it thus far. With that said, the Mental Health Call to Action was a Caribbean-wide initiative with many stakeholders involved. To reflect more on the process of the call to action and its impact, we have a group of diverse panelists here today, all of whom are stakeholders. We have with us our youth leaders, Gabriel Edwards, HCY member and our lead for the Bahamas team, Sahar Vasquez, HCY member and our lead for the Belize team, David Johnson, president and founder of Let's Unpack It and a member of our Barbados team, Simone Bishop Matthews, HCY member and our lead for the Trinidad and Tobago team, Shanique Bowden, executive director of Jamaica Youth Advocacy Network, HCY member and our lead for the Jamaica team. And of course, civil society members and regional organizations, Dr. Karen Seeley, chair of the Trinidad and Tobago NCD Alliance, ATC board member, and CSO support to the Mental Health Call to Action team in Trinidad and Tobago. Ms. Janelle Brooks, mental health and psychosocial support consultant for UNICEF Jamaica, Ms. Maria Boyce-Taylor, associate director, client and employee engagement at CIBC First Caribbean, Ms. Laura Lewis-Watts, project manager for NCD Child, and government officials, Dr. Brian McLachlan, senior consultant psychiatrist at the Ministry of Health and Wellness Barbados. In addition, although unable to join us today during the panel, although unable to join us today, during the panel, we will highlight the involvement of our First Ladies, First Lady of the Bahamas, Her Excellency, Mrs. Anne Marie Davis, and First Lady of Belize, Her Excellency, Mrs. Rosana Maria Briceño. They were both involved in promoting Caribbean youth mental health efforts and have signed on to the call to action. So in addition to hearing from our panelists, we would love to hear from all of you on the call. And so we'll be keeping it interactive throughout the session. To get your feedback, we would like everyone to log on to Mentimeter, as we will be asking questions at various points throughout today's discussion. And so we'll post the link to the Mentimeter in the chat. With that said, we are going to start with a question on Mentimeter. So please go ahead and log on and give a thumbs up once you're on. One of the main objectives of the call to actions was to bring awareness of Caribbean youth mental health needs to our leaders. So we would like to hear from you on how can we hold leadership accountable for prioritizing mental health in policy following this campaign. You can go ahead and click on the link in the chat or use the QR code and start entering your answers. And yes, I will also like to highlight that we have on the call today, Dr. Claudina Cayetano from PAHO. We're very excited to have you on the call and be a part of our diverse group of panelists. We have some answers coming in. Okay, have them show up to public events just like this. Yes, I agree with that. We need more of our leaders represented here on these kinds of calls and webinars to hear from the youth. Put mental health on the ballot. Being brave and informing them of our concerns and ensuring that they keep their commitments, yes. Have them hear directly from youth, directly interacting with them by allowing and engaging them in assisting in policies making. Yes, I agree with all of these. Very good answers. And if you want to continue, you can put your answers in the chat as we'll be moving forward with the panel, because we want to hear from our panelists and what they have to say. Okay, so
thanks a lot, everyone. It's great to hear some of the ideas that you'll have come up with, and I totally agree that we need to have them on board with these public events so they can show their commitment to us as young persons within the Caribbean, and that we want opportunities to engage with them directly. Now, I want us to hear from some of our young leaders, the ones who were, having the flag held high and interacting with our policymakers on our behalf. My first question goes to you, Gabrielle. As you were one of the first young leaders to make initial contact with our decision maker within the Bahamas, Her Excellency, Mrs. Anne-Marie Davis. Could you tell us about that experience and how has it been for you?
A pleasant morning to all in attendance. I am so gracious for this opportunity to share my experience with the mental health call to action in the Bahamas. So I invite you for a short while to come and go with me on this journey. Initial contact was made on September 21st, 2022, requesting a meeting with the Office of the Spouse of the Prime Minister, First Lady Anne-Marie Davis, during the week of October 3rd, 2022, to discuss the 4 overarching calls presented in the Caribbean Youth Mental Health Call to Action, which focus on leadership, research, regulations and policies, and services, and how young people can work with the relevant government ministries and partners to implement the Caribbean Youth Mental Health Call to Action. Another note was prioritizing the multi-sectoral implementation of the Caribbean Youth Mental Health Call to Action with a view to transform mental health systems to better protect the mental health and well-being of children and youth in the Bahamas. On September 23rd, our wishes were granted, and a meeting was set for October 4th, 2022. The team, led by myself, was comprised of Dr. Petra Forbes, Senior Psychiatric Resident at Sandilands Rehabilitation Center, Vernon Davis Jr., and Alicia Muddings, medical students who were on rotation at the Sandilands Rehabilitation Center. In attendance were First Lady Davis and her assistant, Miss Alicia Gibson. First Lady Davis expressed her admiration of the youth organization bringing forth the mental health call to action and offered support to Healthy Caribbean Youth and Healthy Caribbean Coalition for any other initiative during the Mental Health Month. Notably, with call number 1, she mentioned that the Ministry of Health and Wellness was currently in the process of drafting the Mental Health Bill 2022. First Lady Davis mentioned inquiring with the minister if youth were involved in the process, and if not, were we as a group willing to assist in this process. Today, the Mental Health Bill was passed in December 2022, which repealed and replaced the Mental Health Act 1969. Another point of discussion with the Minister of Health and Wellness was the coverage of therapy sessions under the National Health Insurance. With call number 3, First Lady Davis was open to the idea of using her TikTok platform to bring awareness of health-harming substances such as marijuana-laced items by featuring those negatively impacted and the detrimental effect of using these items. Highlighted throughout the meeting as one of the greatest limitations to managing the mental health crisis in the Bahamas is that the Bahamas is an archipelago and not on one single landmass. In closing, First Lady Davis made mention that she will sign and return the pledge once a discussion was made with the Minister of Health and Wellness. On October 25th, 2022, First Lady Anne-Marie Davis signed the Caribbean Youth Mental Health Pledge for policymakers. Thank you for your time and attention.
Thank you so much, Gabrielle. It's so great to have the commitment from the First Lady and your involvement. I think this was one of your first time leading such an initiative, and I know that must have been a bit scary for you at first, but as part of the call to action, we really want to empower our young persons to speak up and demand change. And I think evidence of the the new mental health bill being passed and everything has been domino effects of your efforts. So kudos to you. We'd also like to hear from Sahar, who has been one of our young leaders to lead our Belize team with the call to action. Unfortunately, Sahar could not be live with us today, but she did send a video message with her regards and respondents, given she did meet with the First Lady, Her Excellency, Mrs. Brasinio.
It was a great experience to be able to connect with leaders who are essentially the big decision makers of the country and who implement things to help us move forward. It was very refreshing to see their outlook on things and to also hear that they were excited about bringing change to mental health in Belize and making it a priority, just like we make our physical health. I'm very excited for the future and to see what great things we can do together, and I hope that this can be the norm where advocates, NGOs, regular people are able to connect with big decision makers to make change that will positively impact all of those around.
And that's our message from Sahar. Now we have a really great comment in the chat from Dr. Brown, who has also mentioned that, education institutions are a great first step, but they must not be expected to manage alone, and we totally agree. And that's why it's really important that we have a whole society approach and we build upon other sectors as well, and we ask other areas within where all youth occupy, all space where all youth occupy to improve on mental health and to make the awareness of the needs for mental health and youth mental health services. I now want to turn to David and Simone. Both of you have been part of the call to action team. I think right now we are a family since the very beginning. David, first on to you. But I'm going to pose this question to both of you, but I want to hear from David first. How has the call to action been a catalyst in building momentum to create change at the local and governmental perspectives on mental health?
Well, good morning, and I just want to say thank you to the entire HCC family for bringing us all together, both in this call to action as well as in this webinar today. And I think, Stephanie, I definitely agree with your statements that we are indeed a family. I think that one of the crucial areas where this call to action has been a catalyst is bringing together Caribbean youth in this way. I think it was so crucial to have the organization HCC do this because of your success in developing that level of integration around health advocacy in general. And so to bring the focus to a matter like youth mental health, it was great to have that power in numbers. I think we've been operating in silos as a Caribbean region for too long. And on a matter like mental health, it was absolutely crucial, especially on the heels of the pandemic, to highlight the matter of youth mental health. But I think more so, it was absolutely critical that we've hit home this idea that there can be nothing for us without us. And so it was great to see that young people were the central focus. We were there from the beginning in terms of this youth-led advocacy. We were there in terms of executing the actual tenets of the call to action, and we will be there in the years to come as we continue to mobilize for action. But I think as well, what was absolutely important is that we were able to articulate what were the key problems facing young people, what were the key challenges that they face, and offer our own solutions to the challenges, so that young people are not just a box that we tick at the end after we've conjured up all the ideas, but that we have been sitting at the table, contributing to the programs, contributing to the ideas, and that we can definitely take ownership of this call to action that we've kind of created. I think as well the idea that we must have that kind of whole of society approach And we're no longer going to kind of defer the responsibility, but as a general society, as young people, being key stakeholders in the matter, but working alongside our health partners, working alongside our policymakers to effect the kind of change that we want to see. And so I am definitely hopeful that after all we've done over the last 2 years, that we can definitely look forward to more action coming out of this, that mental health is definitely on the table now for discussion, and that we can definitely act on the tenets of the call to action moving forward.
Thanks so much, David. And I definitely think we can. There are many domino effects that are happening as a result. Now, Simone, you have been our lead in Trinidad and Tobago, and I know you have engaged a number of times with with Trinidad and Tobago's Ministry of Health. Can you tell us about how the call to action has been a catalyst for that and building momentum to create change within Trinidad?
Thanks so much, Stephanie, and kind of echoing David's comments in terms of, greetings to my fellow panelists and the attendees here as we reflect on the long and rewarding journey that this call to action has brought us to. First of all, I think the call to action is a very unique document, meaning it's a document by youth and for youth. I think it's also very timely in its development during the COVID-19 pandemic and that post-outbreak period where we had to learn to live with the virus. Children and youth were identified as one of the most negatively impacted groups in terms of economically, socially, psychologically. So we hear about the importance of including youth in decision-making process on the issues that have or will directly affect us, and the call to action does just that. Through the call to action, we have been given the platform to present our mental health concerns to our policymakers and present them with solutions that we think will be able to tackle them. In the case of Trinidad and Tobago, our initial meeting with the mental health unit, the Ministry of Health, we were able to inform them of the elements of the call to action. And what we found as well is that some of the work that the ministry has done or are considering align with elements of the call to action. And I also think through the call to action, we were able to form this sort of network of like-minded individuals and organizations that's either advocating for youth, they're youth-focused, and with the ultimate goal of changing that outlook and the way we deal with mental health at a national and community level. And I also think that, like I'd have mentioned, a lot of the work that the ministry is doing aligns with the call to action, but I think the fact that the call to action was, a youth-led movement turned heads. And I think that is one of the main reasons why the Trinidad and Tobago team specifically, and in the case of Barbados, where we were invited to further engagement in the development of youth-focused mental health policies at the national level. So it shows that they not only recognize but value our input at the beginning and not during or after the fact. So I think that really speaks volumes. And one other thing that I would like to highlight in closing through this call to action is that we see the conversation of mental health kind of bridging that generational gap and spanning across sectors. So we see persons from older generations, sharing their experience with mental health, whether at a personal level or a family level, and organizations or persons from non-health or health neutral organizations, sharing the importance of mental health for their workforce and, showing support during this movement. And I think that hasn't been done to that level or that magnitude ever before.
Thanks a lot, Simone. Definitely agree. You hinted at this in your response, but I think this needs to be highlighted even further that, following up from your discussions with the mental health unit, they actually invited you and some other youth to participate in the reformation of the adolescent mental health strategy. And I think that was a huge win for us and for the youth of Trinidad and Tobago to actually have us involved in that process. and to ensure that, you know, the strategy that they are developing for adolescents actually involve adolescents. I think that's a huge win, and kudos to you for being a part of that and pushing that forward. I want to circle back to you, David, as Let's Unpack It has been very vocal with regards to amplifying the needs for mental health to be prioritized within Barbados, as well as the wider Caribbean. How has your organization benefited from the call to action?
Great question, Stephanie. And I think there are both four ways that we kind of benefited. I think number one was that given that the call to action kind of really cemented what are the main things that we need to be doing right now. I think for us as an organization, a very early organization as well, in our stages of development, it cemented our mission and our vision. It confirmed what we knew to be true, and it gave us that kind of impetus to move forward for action. So we know, hey, we need to be, challenging our leaders. We need to pursue fully that tenet of leadership. Yes, we do need to, be very vocal in terms of seeking that level of regulation and regulatory change to happen within our nation, as well as across the Caribbean. We needed as well to be very vocal about the idea of research, because as I'm sure everyone can relate to, mental health and health in general has been an under-researched area within the Caribbean, and we need to do something about that, yeah? And so we need to make calls to kind of make that kind of change. And then finally as well, really calling for an expansion in the level of services. And we say this all of the time, that, it's not just, it's not enough to have the services available. Young people need to be aware of how to access them. They need to be able to afford them. We need not to have discussions around the dinner table and have to make decisions about whether I can afford tuition versus being able to access mental health services. So definitely the call to action really cemented our mission and kind of helped us in effecting that over the course of the last 2 years. But I think secondly, Simone stressed this before, the idea of just really building these connections across the Caribbean. I know that our vision at Let's Unpack It is really to, move forward action for Caribbean youth to ensure that they can realize their right to mental health and wellness. And so I think it was absolutely crucial that we could build these key partnerships with fellow youth advocates, fellow young people in the mental health space. And we've seen the results of that. LUA has been included in a number of activities. Thanks very much to the HCC and HCY family. And as a result, so many partnerships and alliances have been built as a result of that. And we know will continue to, carry us forward into the future in terms of developing that kind of action that is actually effective rather than just talk, right? I think one of the third area in which the mental health call to action would have benefited us is, again, in terms of bringing an awareness to the work that we do in a very real way, in partnering with an organization like HCC on this and a number of other regional organizations. We were able to kind of launch our name out there and say, hey, LUA is here and we want to work with you. We want that the youth voice is heard, and we want that you have that kind of safe space that you can come and say, hey, here are the challenges that we have, here are the suggestions, here are the solutions, and we just need a platform to move forward, and LUA can be that kind of platform for you. And I think fourthly, it's really accelerated our action. And like I mentioned earlier, when we first interacted with you guys, we were still within our first year of being an organization. And so to, develop that level of partnership, to see and that standard of how advocacy should be done, how successful advocacy is done, and how we can all work together was absolutely crucial to us getting to the position that we are now. So all I can say from the LUA executive team and certainly the LUA family is thank you for involving us from day one, essentially, and bringing us together to this stage. So yeah.
Thanks a lot, David. And similarly to Let's Unpack It, both the Jamaican Youth Advocacy Network and the Trinidad and Tobago NCD Alliance is also doing a lot of work in regards to NCD advocacy, youth advocacy, and most importantly, as we're all here, mental health. Now, I want to pose some questions now to Shanique and Dr. Seeley. How has JAN and the GNCCTA been incorporating mental health into your ongoing projects? I'll go with you first, Shanique.
Okay, thank you. Hi, everyone. Good morning. So Jamaica Youth Advocacy Network, JAN, since inception, I think mental health has been a significant part of our work. And so it was very powerful, of course, for us to collaborate with HCC on their mental health call to action. So I wanted to share two things in response to the question. That firstly, similar as was shared with the other panelists before us, we also participated in a local meeting with representatives from our Ministry of Health, specifically the Child and Adolescent Mental Health Unit, where we were able to share with them the regional call to action that HCC and HCY developed. But then also, I think I have just other broader discussions about the mental health issues that we are seeing in Jamaica. Two things that I found very noteworthy that arise from that meeting was just, the ministry was sharing with us some of their plans around mental health awareness, and they specifically wanted to know from us, how can they get youth more involved in this discussion? How can they appeal more to young people and ensuring that young people are getting the information that they need? I think David really touched on it, that there's nothing for us without us. And so it was very important to have our stakeholders just really being very open and acknowledging that that is a gap for them in getting across to young people, and how it is that they can do that. And just having conversations about how young people themselves are seeing mental health. And so we are, of course, very inspired to be part of that discussion, and then also have that opportunity to also form a relationship with the MOH and the unit, to now be having further discussions with them around their different campaigns and how JAN can participate. And secondly, perhaps persons on the call know that a significant part of our work over the last year, 2 years, has been around nutrition. And one of the ways we've been trying to diversify our approach to nutrition advocacy here in Jamaica, and especially at JAN, is making it more appealing to young people. And we definitely recognize that there are some linkages between nutrition and our food and what we eat and what we drink and those stuff, and how it may impact our mental health, or it may impact how we feel emotionally and as well as physically. And so that's definitely a strong connection that we've been trying to incorporate in our other work. So we do try to bring a mental health into the wider discussion around nutrition. Specifically, in March, we had a youth forum, and one of the core themes that we explored was this relationship between food and what we eat. Food and how we feel. So our food and our mood and what impact we have on that. And we were able to hear from different stakeholders who would have incorporated different elements within their schools and communities that they think are impacting the mental health of their students or their constituents in a meaningful way. So we had a teacher speaking about their garden that they have, where students, when they're feeling overwhelmed, they can go and sit down and they play classical music, and that's great. We talk about having smoothie days at school, and just the benefit of just like having an apple and thinking about, and just like having the stress come off your body for just that one moment while you're having an apple. So we definitely try to have those conversations in a bit of a more meaningful way, by connecting it to the other work that we're doing and ensuring that we make space to discuss mental health issues and promote mental wellness just as part for the course of our work here. Thank you.
Thanks a lot, Shanique. And Dr. Seeley, how has TTNCD included mental health going forward?
Well, thank you very much for the opportunity to share with you the experience that we have had. For those of you who are unaware of the Alliance, we are an alliance of 13 member organizations whose missions contribute to the reduction of NCDs and their risk factors, and to improving the health and well-being of a range of population groups. And I just want to stress that, which reflect the life course. So we have from breastfeeding associations to the retired persons associations to Families in Action. And just an example of, in fact, the age groups that we cover and the kind of problems that we, in fact, involve all around NCDs. I experienced firsthand the excitement and commitment to success that the Healthy Caribbean Youth has in relation to this call to action. It was a pleasure to meet Simone and in fact have a palpable excitement of the importance of this and commitment to ensuring that in fact it is successful in Trinidad and Tobago. I was able to participate in the first meeting with the Ministry of Health and saw where the Ministry of Health learned from HCY that in fact this is a movement and it's not a matter of a club or a program out there, and that in fact I think they took that on board for sure, leading to the inclusion and invitation to them in the planning for the adolescent health program. The outcome was also positive for our alliance. While TT-NCDA had not been invited to that particular meeting on adolescent mental health, we have since been included in other components of Ministries of Health planning, including for dementia. So here I publicly demonstrate how it's a two-way in our situation. The experience and the relationship has already two-way benefits, mutual benefits on either side. The call from Simone prompted me to reflect on TT-NCDA's priorities. For our last strategic plan, given our limited resources, we took a decision to not include mental health as a standalone priority, but as a cause of or result from the other NCDs or their risk factors. Aware that it was one of the minister's priorities, however, and of what had happened during COVID with respect to the new priority being given in the population to mental health, the CYMHCTA prompted reflection and action by the board on two fronts. We are including mental health now within our work already as we start. And we are also going to accelerate our plan.
Dr. Seeley, you're muted.
We do not have a member organization that focuses on mental health at the moment. So what the board has decided to do is to establish an advisory group on mental health to the board, which will allow us to begin to have that dialogue within Trinidad as to what the challenges are, and also allow us to, in fact, then be able to participate in any future planning for mental health services, particularly youth mental health services. Because, as you will hear, that group is going to be multidisciplinary, multi-stakeholder in its plan. We are also establishing a youth arm. We had this in our plans for quite a while. But here comes the HCY, and here comes something very specific to focus on. And that has definitely created the impetus for us to move forward. Among our membership, actually, we have a range of examples of how organizations deal with youth. In one organization, the Family Planning Association, their bylaws actually call for 2 youth members in the board, right? Not something that you hear of very frequently. On the other hand, we have an organization that has very recently started their youth arm and did this by, in fact, educating groups of adolescents who have now begun to form the first part of their youth program. And then we have the youth arm of organizations such as Caribbean Sport Development Agency. And of course, we have in the Families in Action, there is a focus and inclusion of adolescents and youth in that. So what are we going to do? We're going to convene a youth group from among its member organizations and invite the HCYTT team to be part of that initial group. So they're coming in as the motivators and hopefully to very quickly form a Trinidad Mental Health Youth Group so that they formally then can be seen and recognized at the national level. This increases the credibility of HCYTT team and introduces mental health as one of the initial priorities for our youth group. Work at the national level must be in collaboration with national or community organizations. And this is where we are going to, in fact, help the HCYTT team to garner that support as quickly as possible. The challenge now is mobilizing funds for developing and sustaining these initiatives. And the challenge also, as I've been listening, it's there are two things that I realized that we must ensure that we take up that challenge for. One is, I'm not too sure I've heard us refer to ensuring that we have persons living with lived experience with mental disorders included in our activities. And we have this as a general tenet of, in fact, the advocacy for NCDs. And I urge us to remember that as we go forward in that light. Thanks.
Thanks so much, Dr. Sidi. Very, very exciting news. I love to hear all the progress that's going to come, hopefully in the next coming weeks, months, and within the next year or so for Trinidad. Very, very excited. Over to you, Norgia.
Let me unmute myself first. We've heard some lovely responses from our panelists, and now we want to hear from the audience. In the call to action, we've highlighted our 4 calls, as Stephanie went over in her overview, which are leadership, research, regulation, and services. So if you could enact one policy or regulation to protect the mental health of children and youth, what would your policy focus on? Let us know. Log on to Mentimeter. If you came in a little late, the QR code is up on the screen, and I think the link should also be in the chat. So let us know, what policy or regulation would you want to enact to help protect the mental health of children and youth? Psychologists assigned to every school. I completely agree, 100%. And not just one psychologist, one to meet the population of the school. Free access to mental health services at all levels, schools and communities. Yes, creating safe spaces to share at the peer level and staff level on campuses. Ban on marketing to children, 100%. Integration of mental health into existing systems. Yes. These are all very good answers and things that we have highlighted in the call to action that we want to see in our schools, in our communities, in our countries. Great, you can keep putting in the answers. We're gonna move forward with the panel, and you can also put answers in the chat. So just a reminder, we will have time for Q&A towards the end. So write down any questions you may have so far. Also feel free to just continue the conversation in the chat and pose your questions there as well. At this time, in the webinar, I want to just reemphasize what our panelists have all touched on in different ways through their responses, which is the return on investment for mental health adolescent programs. Most recently, there was a research article last year that assessed the impact of addressing various mental health disorders during adolescence on health and non-health outcomes across 36 countries. Results from this study found that interventions with the highest return on investment were those that were treated for mild depression and school-based prevention of anxiety and depression. In addition, it was found that for every $1 invested in the full set of interventions to address mental health conditions, it is expected that $24 in health and economic benefits would be returned to the economy over the course of 80 years. So what does this mean? Plain and simple, intervening to prevent and treat these mental disorders, even only during adolescence, can have lifelong health and economic benefits. And so, with that all said, we are happy to have the support of government officials like Her Excellency Mrs. Anne-Marie Davis, First Lady of the Bahamas, and Her Excellency Mrs. Rosana Maria Briceño, First Lady of Belize, who have signed the call to action, who will help promote this return on investment for mental health adolescent programs. But unfortunately, they could not be here with us today, but their commitment to promoting the Caribbean youth mental health is reflected in their pledge. So as Special Envoy for the Development of Families and Children in Belize, Her Excellency Mrs. Briceño aims to build relationships with and empower vulnerable families and children with a focus on special needs youth and families. Over the next 5 years, Mrs. Briseno, intends to increase meaningful participation in Belize's development through supporting vulnerable families and youth in achieving healthy, productive lives. Her Excellency, Mrs. Davis, has also pledged her commitment to be a champion in advocating for the reduction of mental health stigma and will work towards vigorously improving the accessibility, visibility, and quality of school-based mental health services in the Bahamas. In addition to our First Ladies, we also have representation from the Barbados Ministry of Health and Wellness through Dr. McLachlan. The Ministry of Health and Wellness has actively shown commitment to meaningful youth engagement through engaging with us at mental health stakeholder meetings and at the Small Island Developing States high-level meeting that took place back in January. Dr. McLachlan, what steps has the ministry taken to collaborate with the youth to address the mental health crisis in this population since your initial meetings with the mental health call to action team?
Well, good morning and thank you very much for the invitation. I hope you're hearing me loud and clear.
Yes.
Okay. It's clear because since certainly last year, we've been seeing really a lot of children and adolescents presenting to our treatment services. And of course, we're blaming that on the pandemic. And even though we're on the tail end of the pandemic now, unfortunately, we are still seeing a lot of young people who are presenting to our services. And when they're presenting with things like depression and suicidal ideation, then obviously the concern is really quite great. And fortunately, the pandemic, what it did, it created some dislocation for us in terms of offering services. And we've recognized that we still need to be offering services to our young people. But that has been a challenge, but we're definitely working on that. Two things I will say that have occurred, certainly, and I support the young people in terms of their advocacy in this matter, because when everyone is sitting around making decisions and making plans, it's sometimes easy to sort of forget certain groups. And I think what we're seeing has come about as a result. I'm aware that a group like Let's Unpack It, for example, has done quite a bit. They partnered with an organization I'm also part of, the Barbados Association of Psychiatrists, in terms of promoting matters and focusing on young people and mental health. The Mental Health Commission, and this is an advisory group to the Ministry of Health, and has been re-energized, and that group advises with regards to matters related to mental health. And it's a committee, but it also works through subcommittees as well. And I'm quite sure that we're going to be seeing, in some of those subcommittees, young people being on board to help advise on what needs to happen with regards to mental health. The big thing that has happened, though, and I think we've heard it before, is really that the ministry recognizing that mental health, and not just mental health for young people, but even for adults, has really been a big problem. We partnered with PAHO, and PAHO is actually working on a roadmap for mental health for the country. And that has involved consultations I think you've alluded to, where certain youth were well represented, as well as the WHO since meeting that was earlier this year. But PAHO is doing a series of consultations. There's actually one going on even as we speak. It started yesterday, which I was a part of. And again, we're sort of looking at all things mental health, which involve issues with prevention, promotion, and treatment. And so looking certainly forward to good things coming out of that. We have to revamp quite a few things, our mental health act, our mental health policies, and make them certainly a lot more relevant to where we are today. With young people, with the rights of young people, we have a new child justice bill, and that also has to be taken into consideration. And I know that, again, groups such as yours, again, have already made impact and already have spoken to our Minister of Health and met ministry officials. And so I expect certainly that, again, your views and continue to have them and bring them are going to impact on where we are going to be and where we're going to go and how our mental health policy in general is going to flesh itself out. And an important part of that is what's going to happen to our young people and how we're going to manage our young people.
Thank you for your response, Dr. McLachlan. I'm happy to hear that the Mental Health Commission will be energized. Just as a follow-up, how does the ministry plan to incorporate recommendations from the mental health call to action to promote psychosocial well-being?
It's interesting you can say that just yesterday, because at that workshop I mentioned, we were discussing the need for mental health policies, really and truly in not just the Ministry of Health, but actually in all ministries, and that would include the Ministry of Education, Ministry of Youth. So we certainly believe as a strategic goal that that needs to happen. How that's going to happen, obviously, is going to need a lot, it's going to need a discussion. But really making mental health, taking it out of just the Ministry of Health and making it a national endeavor, affecting all ministries, affecting NGOs and so on, something that we really and truly will be doing. With regards to disaster management, we discussed the need for psychological first aid training for the population in general. That has started. One of my colleagues has been, again, assisted by PAHO, has been offering psychological first aid training for various groups. And I'm not sure whether or not young people have been approached, but really and truly that should happen, because disasters, crises are going to affect young people as anyone else. And young people, helping young people, I think, will be quite useful for that. We've identified stigma and discrimination as being a concern. It's a concern with regards to having a mental health condition, seeking mental health care, even hearing mental health promotion messages. And so we recognize that has to be tactical and dealt with. And again, that's going to be part of what we're doing as far as our roadmap is concerned, because mental health promotion has to, and education has to be such that we decrease stigma and discrimination. It may look a little bit different for children as opposed to adults, but again, it's perhaps harder for young people, really and truly, because it affects things like school and their socializing and so on. And therefore, again, I think we perhaps need to hear from the young people with regards to what strategies we can be using specifically for that. And as regards to services and the provision of services, we still have services, and we still have services which are free at the point of delivery, but we need more, and our experiences at the moment say that we do need more. And we not only need numbers, but we also need, again, it's the type of services we need and the type of clinicians that we need to go along with the promotion that we're going to do, because we also need to try to, prevention, as well as to empower resiliency, all those things. But we kind of need resources on the ground to do that. And the use of technology, that's the final thing I'll say, and the use of technology as well. Perhaps that's going to help to do that, and is also going to be important. And young people are best people to discuss how to use technology efficiently. That's my view. And certainly, I think, we will have that discussion about how to deliver those messages to young people, just by, what is not always traditional sort of methods of communication.
Thank you, Dr. McLachlan. I look forward to seeing, how your recommendations are incorporated, especially the educational piece, catering to the different age groups within the population to help decrease stigma, because that's very necessary in promoting mental health efforts and making sure that they are sustained and efficient. Moving on, we want to hear more from our audience. I know we've been talking and hearing good stuff from our panelists, but we also want to hear about what you all think if you could permanently remove one barrier to mental health services in your country, and what that would be. So go ahead, get on your Mentimeter, get typing, and let us know what barrier you want to remove in your country to mental health. I see here the chat has been very active, and Yvonne Lewis has left a great response in the chat, and I'll just point out some of the things you said. To address the issue as an inequity issue, yes. Keep the issue of mental health and youth mental health in the public view through uses of the traditional media and social media. And that's where Dr. McLachlan talked about technology use. How do we continue promoting mental health through technology and getting everyone technology efficient? And even outside of that, in our communities, how are we having conversations about mental health? So definitely keep promoting it. Okay, I see some responses coming in. So the high cost of, I'm assuming high cost of private Okay. Stigma, the cost, right? User fees, financial barriers, national health insurance. So what I'm seeing here, a common theme is the cost and finances to accessing mental care, mental health services in our different countries, the stigma, the discrimination. Yes, these are all points, areas that we need to address in order to have mental health promotion sustained in our country and improved. Okay, so now we're gonna move on from our Mentimeter. You can continue putting stuff in the chat. I want to hear more. And on to you, Stephanie.
Thanks, Jaya. It is pertinent in order to have a whole of society approach that we reach out to our regional organizations to truly have a united voice with regards to youth advocacy and especially mental health. One such organization, regional partner, is UNICEF and UNICEF Jamaica. I want to turn to you, Ms. Brooks. What has UNICEF Jamaica been doing to accelerate youth-informed change in the mental health space?
Good morning, and thank you for having me. So UNICEF Jamaica has always been involving the youth in everything that we do. I have to say that we have a strong relationship and partnership with JAN and also the Ministry of Health and Wellness here in Jamaica. And mental health is also not only a priority for Jamaica or country office, but it's also a priority for UNICEF Global. There's a strong push in terms of our programming and our advocacy this year in particular. So some of the things that we are planning for this year is to have a youth mental health summit in a few months where we'll be bringing many youth together as well as government leaders and officials to discuss mental health, but more importantly, come up with a sustainable plan for how we treat with mental health services and interventions going forward. So that is what we're doing in another couple of months. And we will also be participating in the development of a youth mental health network. So we are trying to bring youth together to be an advocacy arm, so to speak. And then we're also hoping to join with other colleagues in other Caribbean countries to come together to do so. I'll also note that we have our You Matter chat line, which is 1 year young now, where we provide free confidential services, psychological services through text, because we know that young people are more into texting rather than talking, meaning voice talking or in person. So we just celebrated our 1 year anniversary, and we had just over 2,000 contact hours, contact sessions. So that service is being well utilized, and we are going to continue to strengthen it and build it, and hopefully we can extend it to other countries and jurisdictions as well.
Thank you so much, Ms. Brooks. I'm really excited to hear that the You Matter Health hotline has been so active, and they plan to continue it. And so any Jamaicans that we have on the call, that service is available to you, and we'll be sure to include it when we share the resources at the end of today's session. It's also very important to have a complete whole of society approach when we're tackling any health issues to achieve our desired health outcomes, and mental health is no different from this. Therefore, there is benefit in having health neutral private sector to play a role in the mental health promotion efforts. With that being said, I would like to hear from Ms. Boyce Taylor from the First Caribbean. How has the CIBC First Caribbean been supporting mental health of your staff, especially the younger members of your organization?
Thanks very much. Good afternoon again, and thank you for the opportunity to share. Well, as you rightfully said, we are neutral in this space, but we are very passionate about it. So one of the key things that we've done is, first and foremost, is we have a strong MOU with Healthy Caribbean Coalition for over 5 years. So we put our money where our mouth is, as they so say. So we are very heavily involved in the initiatives and programs that they provide. And we have over 2,000 staff members across the region. And one of the key things that the organization has done is created a program, or the segment which I head, which is client and employee engagement and cultural transformation. With a young staff, our staff complement is actually becoming younger and younger in terms of as persons retire. We therefore had to create a robust program. So we have a program called Wellness in Action, which speaks to mindfulness, it speaks to physical health, it speaks to mental health. It also speaks to creating a safe space for persons to share. So we do have programs such as something called Thriving Conversations, which is support groups, where persons can join with our EAP program, which is our employee assistance program. And there we have therapists where you can join, and we consider them safe spaces. But we went a little bit further than that, and we created something called Engaging Moments, which is a vlogcast, where we have one team member, primarily younger persons, interview another team member, and it's a space where we share our vulnerabilities, whatever we're dealing with, whether we're dealing with mental health, mental wellness, we're dealing with an aging parent, we're dealing with our own insecurities, our own anxieties. So we wanted to create a community within our staff. We have a high functioning staff, they work very hard. So it was really important for us to do that. And from our leadership, we have a program called Move with Mark, which is our CEO, where every Thursday we get together and we take a walk, whether you're in Barbados, Jamaica, Grenada, wherever you are. And out of that, we created affinity groups. So if you're a dog lover, whether you're a plant person, you can go to those spaces and you can have the opportunity to connect with other people who have similar interests, because the goal is to create spaces and an environment and a culture where people can share openly, where they can discuss their concerns, but also where they can thrive. And thriving is really important as a critical part of mental wellness. We also have mindful moments. So on Mondays, we get together and have a mindful moment. We share something that can help you in that process. And we have breaks throughout the day, but you can take a break, take a walk, you can stretch, you can just do a little bit of meditation, whatever it is that you require. The uptake of these programs through the engagement initiatives, through the support of Healthy Caribbean Coalition, who was critical in supporting our wellness in total, has been phenomenal. We have seen such an improvement in our employee experience. We have seen such an improvement in the families, because we're not only talking about our employees, we're talking about their support systems, we're talking about their families. So Healthy Caribbean Coalition and CIBC has started called Continue, and with the help of Danielle, who's on this call, I know, we're doing our summer fitness. So we get together on Zoom, and we have fitness classes for our staff members and their families to join in. So there's a collective and a community, again, that is beyond our staff and outside of our staff. So we do take mental wellness very important. And finally, our Adopt a Cause program. Sometimes when you focus only on yourself, you get lost, but when you can focus on your wider community. So we create volunteer programs, and we give our staff members the opportunity to fund the program, and the bank matches whatever they fund. So homework classes they will go and do some cleanup. So sometimes you need to look outside of yourself and see where you can see your value beyond just, your issues or your problems. And therefore creating a space for that was extremely important for us. So our program is extremely multi-focused. It has many prongs, but the goal of the program is to ensure that we can touch each employee in some specific way that will connect with them, whether it's movement, whether it is through therapy, whether it is through community groups, whether it is through support groups. We have to find a way to ensure that we support our very high functioning, but very, very, very dynamic team. So
thanks
again,
so
thanks
much
for the opportunity.
Thanks so much, Ms. Boyce Taylor. I think CIBC is doing a great job of engaging with their employees, and I think for anyone on the call, on the panel, as well as in the audience, you can take a leaf out of CIBC's book and really engage with your employees and prioritize mental health within your organization. And there are very simple things you can do: the Mindful Mondays, the walks on a Thursday, really great initiatives. And I want to applaud you for that. And I really want other organizations to also practice some similar initiatives. We've also gotten a lot of support and guidance from our regional powerhouse, the Pan American Health Organization, and we are so grateful to have Dr. Claudia Quintano on the call with us. Now, Dr. Quintano, given your involvement and continuous feedback throughout the development and rollout of the call to action, how impactful has this campaign been from your point of view?
Thank you so much, and congratulations, Stephanie, and your team and your group. I had the opportunity to meet you personally when I was in Barbados, precisely what Dr. Ryan was talking about when we were supporting Barbados, so we continue to support Barbados on developing their roadmap to have, for the mental health policy. And this is very important. As you know, I've seen a lot of changes. The fact that you were there, you were representing, it's very unusual that we get adolescents to be part of this kind of consultations. So, and I was very pleased to see that in Trinidad it's happening in many other countries in the Caribbean, and that's exactly what we want. And why do we want that? Because when we look at, so PAHO conducts every 2 years a survey, which is the Mental Health Atlas. And that Mental Health Atlas, one of the question that we asked our countries is, do they have a mental health policy for adolescents? And as you all know, the answers. So, we have very little, it's not about pointing fingers, but we know that only about 30% of countries say yes. So the majority of the countries says no, that doesn't exist. So that's again, it's a gap, it's a huge challenge, because if we don't have a map that guides us, if you go to a country, any country you visit, you need to at least understand the language, at least have a map, at least know where you're going to go, what you're going to be doing when you're there. So if we don't have that policy that guides what support, what guidance, what interventions are relevant for adolescents, so we are in trouble. So we need to do that. So I think your group, definitely congratulations for doing that, for being there, for being active and making your voice heard. Another thing that I find interesting, and it was said before, but I have no problem when we repeat ourselves, because I also believe that we learn by repetition. I think some of you know that the issue of repetition compulsion. If you have small kids in the house, they want to watch the same cartoon over and over because they want to learn the words, they want to so this is important. So someone mentioned again the importance of person with lived experience. We need to make sure that we have adolescents with lived experience where they're comfortable to be able, but of course with guidance, to talk about what it is like to have been diagnosed with depression, and now you are contributing. You're a citizen, that the fact that you have a mental health problem does not mean that you cannot contribute. What is it like to have an anxiety, being diagnosed with an anxiety, and still be able to contribute? And I have been really blessed to see in the Caribbean, and you I don't know, Stephanie, when you came, if you came, or some of you probably participated in the SEEDS meeting, where there was a person, there was a lot of people with lived experience from Trinidad, from Barbados, and these are young persons saying, listen, I've been diagnosed with a severe chronic mental disorder, and here I am, married with a child, with, contributing, having a disease. Having a disease does not mean that I'm sentenced to not to be contributing to my community. And I think these are important, that we have to advocate to have people with lived experience in our groups, in our, in the work that we're doing. So as you see my background, Do You Share, to promote mental health. It is because for us, stigma is so important, and we need to be able to target stigma and discrimination. That's definitely where we want to put our money in. So when we have, from PAHO, we run the campaign on Do You Share, Stigma and Discrimination, but it was not just a campaign. We also have a virtual course for healthcare providers on stigma and discrimination. And why that is important? Because it's used, I find it, I'm a physician, and I understand the importance of having access and free of cost, but it's useless for you to go and see someone who will end up discriminating you and minimizing your concern, not really caring, like thinking, oh, you're just oh, you're just acting up, or maybe you should do, or you're looking for attention. No, we want people that are providing these services. If we're creating a directory of services, we need people who actually have an attitude of support, of kindness, good communication, and they're not there to judge you because you have different values from them, or because you find yourself to be trans or to be LGBT, whatever is your choices. This is your personal choice, and you're asking for guidance. So we need to make sure that people who are providing these services are actually free of stigma and discrimination. So one of the tests, when we do this training, we ask there is a pre and post questionnaire when we ask the trainees, would you be comfortable to, if you had a mental illness, would you be comfortable to talk about it? Would you be comfortable to work with someone in having someone in your work that has a mental health problems? Will that be okay? Do you think someone who say that they have been diagnosed with mental illness are weak? Is that a sign of weakness? So these kind of things, we need to be able to talk about those. And the other thing that is relevant, as you know, kids spend a lot of their time in schools. We all did in our time, so many hours. So we also need to make sure that teachers are, and you have that in the call for action, the promoting mental health in schools, promoting well-being in schools. So we launched our publication for the first time, a publication on promoting well-being and mental health in school, which is a tool for teachers to build the skills in be able to understand mental health, be able to, increasing the literacy in mental health. That's extremely important. And when we did that, of course, we had to be guided by yourself. So you know that PAHO has a PAHO Youth for Group Health, and we consulted. I was very impressed to see the consultation with the group, with the youth. They were able to see things that we didn't even consider. And I like that, because you bring another voice to the conversation. You bring another perspective to the conversation. So when you are in these meetings, please do not be scared to raise your hands and to ask questions and ask clarification. We need to be able to hear from you. And again, I think this calls for action. It's not just, I wanted to participate, as you know, because I don't take it, it's not a tokenism. You will make a difference when you call, for politicians, they need votes, but then you know that they also need to be able to listen to you, and you need to be able to say if they are serious about child and adolescent mental health, that needs to be reflected, and that's the person I want to back up. So the same thing for our organization. For us, definitely, as you know, I work very closely. I'm an advisor for mental health, but I also work very closely with my adolescent health advisor. You all know Dr. Sonja Cafe, and so it's always been a pleasure, that we work together in this endeavor. There's a lot of things, but in the interest of time, Stephanie, I want to stop here. I just want to again congratulate you. This has never happened, as you know before. I've been doing mental health for over 30 years, and I'm always amazed to see what you can do with such a little bit of time. You have been moving and shaking things, not only in Barbados, but it's in all the Caribbean countries and islands, and I really like to see that happening. And I know you just there's a lot more to come, given what you have done so far. Thank you.
Thank you very much, Dr. Kitano. And I really want to highlight the initiatives that PAHO has been doing, the Do Your Share campaign, the trainings that you have. And again, we will be sharing these resources within the chat and with all of our audience as well, so they can take part. A lot of this call to action has been happening over the past year, and a lot of the activities, the immense reach we've had in all of the countries across the Caribbean would not have been possible without the financial support of Entity Child through their seed grant. Thank you again to Entity Child. I want to turn now to Laura, our representative from Entity Child. How do you, and by you I mean the organization of Entity Child, intend to support Caribbean youth and future youth-led projects within the Caribbean and beyond?
Sure. Thank you so much, Stephanie. I'm so pleased to be here today in support of this initiative. And just to represent on behalf of Entity Child and the Young Leaders Program, I think it's wonderful how this call to action really positions youth front and center in order to reimagine policies and systems so that their needs are really met. So NCD Child is really a global coalition, but some of the most important work that's happening is happening at the regional level and at the country level. And we really want to continue supporting this work. So in developing the Young Leaders Program and then providing the seed funding for some of these projects, we really see our role as facilitators and providing a platform for young leaders to learn from one another, to share ideas and to experiment. And also to provide, a space to support each other, because, the mental health of advocates needs to be protected and recognized as well. So when we designed this program, we really wanted it to be impactful. We kept it to, a smaller cohort of 25 young leaders from around the world. And we made it a 2-year program to really give enough time for young leaders to develop, the skills that they need and in advocacy, and also just to design and implement their own projects. We also have an aim to really support young leaders to bring these ideas to global forums and also to get space time with key stakeholders. Unfortunately, the pandemic really limited that. So what we did do during, in the middle of the pandemic was to create more online resources that are available to support young leaders in their advocacy efforts. So we created a global advocacy course, which is free and online, and it has different interactive modules on the NCD global burden, as well as some of the major risk factors among young people, and also some of the advocacy tools that they can adopt and use to take action. We also developed an online burden of disease dashboard. So this looks at NCD data that's very specific to the 0 to 19 age group. And it provides a snapshot at the country and at the regional level of, NCDs of concern, including mental health and risk factors. So I do encourage everyone, these are still available to visit the NCD Child website and to learn more information about these resources. But coming back to this call and looking towards the future, we do really want to support more work like this. We want to bring on a new cohort of young leaders, and we hope to do so that we can, support them to a new generation of young leaders to continue this work. As someone mentioned, building on the shoulders of others. So we do hope to keep engaging our excellent alumni, including Stephanie. So I just wanted to say thanks again. We really support this work. As it was said earlier, this is not just a one-off activity or a club, it's really a movement that's building. And I'm really excited to see more of the outcomes down the road. Thank you.
Thank you so much, Laura. And again, thank you a lot to the NCD Child for funding this initiative. And I hope, as you said, there will be future opportunities as well. In the interest of time, and I know that we have had such a wonderful panel, such a diverse panel, and hearing all of the insights, we would like to hear from our panelists, our audience, and see if there are any questions they might have for our panelists. We really like to see if there are any concerns, anything you want to raise. Please use the Q&A function or put your questions within the chat if you have any questions for our panelists. In the meantime, I think I want to open the floor to the first question for our panelists. What are some of the key lessons or takeaways that you've learned from this campaign? I first want to pose this question to any of our youth leaders on the panel. Are there any key lessons that you've learned from hosting this campaign or being a part of this journey with us?
I think I can go, Stephanie. I think definitely for me, one of the key things standing out is that there's so much power and value in numbers. I think, again, just looking back on this campaign and how it really brought together youth from across the Caribbean. I think Dr. Seeley would have mentioned the idea of, not knowing that some organizations existed. And so every day, in and out, there are young people on the ground championing the cause for mental health. And I think it just gives so much more credence to their work when we can band together and generate a region-wide kind of action. And I think this sets the standard for our work moving forward. I no longer want to see us, just struggling alone. But in the spirit of mental health, I think there is so much value in unity and in, solving this problem, solving the challenges together, and no one person having to carry that burden alone. And so I really think that there's so much value in the numbers there, in the synergies formed, and I think this is definitely going to move our action around youth mental health forward.
Thanks a lot, David. We have a question in the chat for Dr. McLaughlin. From Regina Thomas. It says, you mentioned that more young people have been taken, you've mentioned that more young people have been taken your services. Why do you think that's so? And can you offer any percentage that would represent how much young persons have been accessing services within the last year or so?
I can't quite offer a percentage, but the reasons we think, again, would have arisen out of the pandemic situation and the disruption that was created with regards to schooling, obviously moving into online indoors, and there were a lot of problems with online schooling for some kids. Some kids actually did better with it, but others really and truly did not. Some obviously missed the socialization that took place at school, and which they weren't then getting at home. And unfortunately, having everyone, I think, at home really just amplified some of the difficulties that existed in families. And in the context of socioeconomic issues arising, it really then, I think, brought a lot of these sorts of issues to the fore. And the young people, again, perhaps not being able to manage those as well as some of the adults. And remember what I said before, the adults have their own problems as well. I think since we know, again, we've reopened schools and we've gone back to schools, but again, things have not kind of settled yet. Not everyone has come out of the pandemic situation sort of intact, and people are still grappling with issues related, again, to socioeconomic status, and some have been ill. And so some of the pressures and issues are really truly still there. We recognize as well that, again, for some of the persons that are coming to our services, remember, we have public services, we have a point of delivery. There are persons for reasons of stigma and discrimination would ordinarily perhaps go somewhere else. But again, in some instances, again, socioeconomic circumstances have led to them coming to us. And this wasn't surprising. During COVID, we had quite a bit of disruption again, and certainly even the private services, this person simply were not open. But we just recognized, certainly there's a clear need. And the last thing I would say is the Ministry of Education did introduce into some schools social workers and some counselors and safety officers. And what I think has happened is they have, as they go through the schools, been able to identify youngsters who are having challenges, and again, then referring them to us. They're bringing them to the attention of guidance counselors and principals, and then they're referring them to us. What probably may have happened before is that some of these would not necessarily have been referred, and again, parents or guardians may not have readily wanted to bring them to our attention, hoping that the situations would just go away. But now, with the presence of those personnel in schools, they have identified, children having difficulties and have, brought them to our attention.
Thank you, Dr. McLaughlin. We also have another question from the audience. Is there a plan to improve access to psychiatric help for preteens/teens in Barbados outside of the stigma-filled psychiatric hospital? What free services are available for youth?
There's been a second part of that question, but anyway, we have certainly what we now call child and adolescent mental health services, which before the pandemic, we had moved out of the psychiatric hospital into and became part of our community mental health services. Unfortunately, with the pandemic and all the, the need for space in the polyclinic, we did have to revert to those services coming back into the hospital. And again, we're hoping that now with the tail, or being what we hope is a tail end of the pandemic, that we're going to be able to move back out into the community again. And in fact, part of the roadmap that we are doing really is focusing a lot on community mental health services in general, and certainly specifically for child and adolescent mental health as well. Because we also need infrastructural and human resource increases as well, we are hoping that we're going to be able to offer child and adolescent mental health services in the community. We are seeking actually to get more psychologists to be able to place in the community, more persons with psychiatric training in the community, also assisting our primary care and our general practice colleagues also to identify more mental health problems with children and adolescents that have been dealt with in the community. So that's part of what is happening in terms of where we want to go. And again, we're now really sort of sorting out the steps to do that. So as it is now, persons can make an appointment certainly with our community mental health clinics. They traditionally have seen adults, but they also do see children as well, who we see at the hospital are usually more urgent ones, those who are threatening self-harm or have made gestures to harm themselves. But our move is going to be having these services really in the community at our polyclinics and our outpatient clinics. And so hopefully that will reduce the stigma that does unfortunately still exist with regards to coming to the hospital.
Thank you. We do have posted in the chat a comprehensive list of mental health support services in Barbados, and also a mental health crisis hotline directory for the Caribbean. So please check out the chat and put that in your list of resources. Another question that we have, and I think I'll pose this as well to the audience: what kind of programs would the youth like to see sponsored or supported by the private sector in regards to mental health, supporting mental health promotion? We can hear from some of our youth advocates on the panel as well.
I think definitely, Norgia. Before we jump into that one, I just really wanted to address something that was mentioned in the previous question, the whole idea of stigma. And so I do give credence to what Dr. McLaughlin was stating in terms of the move now to a more community-based approach. But I think it's also crucial that we do more to kind of break down the services, to also break down the pathway to care for young people. I think a crucial reason for the stigma that exists is because people don't fundamentally understand. We understand that if I go to my physician, that there's a certain course of treatment that's going to happen. I'm going to get medications. If there's an emergency, I go to the accident and emergency department. I think that pathway to care is not very clear for a lot of young people, particularly. And so we need to do more in that department. And we also need to do more to directly address some of the misconceptions that have been allowed to sit there and simmer for a long time around the whole idea of mental health and what it means to have a mental illness. So I think a more aggressive awareness campaign is definitely one of those key areas. And coming to your second question, Norgia, that is definitely one area where I believe the private sector can help in terms of putting the money behind these awareness campaigns, something similar to what we saw with the HIV AIDS awareness campaign. I noticed as well in terms of NCDs, we've been doing a lot in terms of putting investment behind the various runs and walks and drives and blood campaigns, etc. I want to make it very clear that mental health is now regarded as an NCD. So there's no reason why we should be extracting it from our wellness campaigns. There's no reason why we should, be separating it from the various campaigns and initiatives that we're implementing. And so I do hope that moving forward, we can regard mental health as one of those core components. And so definitely the private sector can be investing in terms of awareness, but more so other things that we know help in terms of not only the community-based services, but community-based programs. Something as simple as having a community center where we have a homework help program. There are those areas of overlap between a child being able to have a place where they can go and do homework after school in a safe environment. Having a community gym, we know the correlation between good physical health and good mental health. And so there are simple ways in which we can kind of effect the level of change that we want to see that will benefit, yes, the young people, but the society at large as well. And so I think what we need moving forward is that everyone, takes that level of responsibility for mental health. In Barbados, we have this saying, tourism is our business, let's all play our part. I want to see that same level of energy for mental health. Mental health is our business, let's all play our part. Have the private sector involved, have the public sector involved, and have every single individual involved to make mental health a priority and a lived reality for all, for sure.
Thank you, David. And I can see folks in the chat are also agreeing with you with their responses. Mental wellness programs and projects in schools and community spaces. Yes, Renee, I agree with that as well. Mentorship programs, having persons with lived experience involved, we can also help with this, and other individuals as well. Mrs. Maria Boyce-Taylor, I know this question, you are with the private sector, so if you have any input on this question, we'd also like to hear.
Okay, especially from the private sector, we have a responsibility to our employees and to our clients, which is the wider community. So therefore, I think the private sector will sponsor activities. In our case, we are the biggest sponsor of breast cancer awareness and breast cancer screening in the Caribbean, which is very important to mental health. Because if a woman is ill with mental health, their children are impacted, their partner is impacted, etc. But I do also believe that we have a role to play in terms of supporting the youth in mental health, in terms of not only our own employees, but like what we try to do at the bank, as you just mentioned, I think David mentioned homework programs. We run homework programs across the region. We go into schools and we actually have our staff do that. It helps their mental health and it helps the mental health of the young people. I think we can't always think about grandeur things of major funding, but actually one person, as I like to say in my own team, one person at a time, you make an impact one person at a time, one community at a time, one country at a time, and that's how it grows. So yes, there's a major role to play. I think we also have to do a lot of work in the private sector to let them understand it doesn't always have to be a party you sponsor or a carnival that you sponsor. That is how mental health as well, getting the opportunity to release, but we can also do real community work. And I am really proud of our organization that we get out there and we do it through our Adopt a Cause, but we can do real community work to support young people and provide safe spaces for them to be able to thrive and to grow. Some young people do not like to go home. So maybe community centers, supporting a community center where they can learn dance, they can learn a craft, etc. Also having the ability to support mental health practitioners. And that's something that we were talking about in our own organization. How do we support the practitioners from a corporate perspective who support persons in mental health? That's really important. We know we're talking about youth today, but we also have to talk about the practitioners, the specialists who get out every day and deal with this, and how are we supporting them to support their mental health? So there are a number of areas that we can work. I know our organization is doing its best, and I'm hoping to see other private sector organizations take this as a priority, because we ourselves at the bank get many persons who come to us and say, I love what y'all are doing for your staff. I wish my organization did that. I wish my organization. So the need to see it as a priority, it will grow your revenue. It will help your organization to grow if you have engaged employees who come to work feeling safe, coming to work, feel that they can grow, And I'll tell you this, and I want to say this very openly, we are on a journey. We are nowhere near where we need to be, but we are committed to the journey. And that's also very important for the private sector.
Thank you, Mrs. Boyce-Taylor. And that's what we need, commitment to the journey, to see mental health in all sectors of our countries, in our communities, in our homes, in our workspaces, in our schools. And so I am aware of the time. And so I will just ask one last question to give everyone a chance to answer before we enter closing remarks, which is, what are next steps for youth-led advocacy in the Caribbean? You can also write your answers in the chat to that question from our panelists or anyone in the audience who wants to answer. And I will hand over to Danielle so she can give our closing remarks and any last minute messages.
Thank you, Norgia. Hello, everyone. Good afternoon. Thank you so much for hanging with us. What an inspiring webinar. If you agree, I'd like to see some hearts in the chat. Fantastic. I can't thank our panelists enough for such insightful contributions, and to our moderators for leading with such grace. In the development of the call to action, we had over 50 consultations, and I want to take a moment to thank all of those people, some of who have become family through our mental health call to action subcommittee. To our allies, including NCD Child, who've supported the youth in making this call to action reality, thank you. As Dr. Seeley mentioned at the very outset, and it was reiterated by Dr. Caetano, you all are part of history. And a special thank you to Stephanie, Norgia, Simone, and Carrie, who have been helping to coordinate not only this webinar, but have been driving this mental health call to action effort for well over a year. And your passion and leadership have brought us here. And we couldn't do this without the overarching support from Maisha Hutton, our executive director, who continues to create spaces for youth to shine, as well as the rest of our HCC team, Ian Pitts, who created the fantastic mental health call to action website, putting in a plug there for Ian, Janae, Sheena, and Sir Trevor. This event, as well as the call to action journey, has truly been a team effort. Thank you to all of you for being here. All of you audience members to being here and showing your support for this campaign. I know we are short on time, so I do want to get to some key takeaways and action items for all of us, because as we heard today, there's lots to celebrate, but we also still have some homework to do. So inviting you to get your notepads out so we can take some notes here. I hope you've been doing that throughout the webinar so far. So one key takeaway, the first one, I have three. This call to action has magnified the power of youth voices and its value in tackling and improving youth-centered concerns and needs in the spaces that they occupy. First action for you, develop or strengthen mechanisms for youth to be involved in decision-making spaces, whether that's at the organizational level or country level. At the national level, if there is a mental health policy being shaped in your country, and we heard the urgency of doing that from Dr. Caetano, it shouldn't be a question. Youth, especially those with lived experience, as we heard from Dr. Seeley and Kimora in the chat, should be involved in crafting that policy. Their contributions will help to create a sustainable policy and program to better suit their needs. Second key takeaway, mental health care and support doesn't follow a one-size-fits-all approach. I think we heard that clearly today. So support systems that are available and are being considered should be tailored to reflect the needs, age groups, and experiences of its users. So action here, we need to implement or improve mental health support services and resources, especially within school environments, so they are accessible, affordable, adaptable, sustainable to ensure the psychological health and well-being of current and future generations of young people. We need to ensure that youth are part of the development and monitoring of these services. Last key takeaway, safeguarding the mental health of children and young people is multidimensional and requires a whole of society and whole of government approach, which we heard today, to really control their exposure to health harming products and experiences such as unhealthy diets, physical inactivity, tobacco and vaping products, as well as alcohol and bleaching products. So relatedly, policies and programs should be introduced, expanded, and enforced to regulate digital harassment, stigma, and bias. Action. We need to gain a better understanding of the physical, social, commercial, and economical factors that children and youth are experiencing and are exposed to. Seeing the bigger picture of the various lived experiences of young people can help to address and tackle the challenges that impact or can potentially impact their health, particularly their mental health. And my final big action, develop or strengthen existing youth-focused policies. Again, we heard that time and time again in this conversation, to encourage a health in all policies approach with a specific focus to protect the spaces that they live, work, and play in, really acknowledging their right to health. And lastly, this is an easy homework item. If you haven't already, please sign the call to action in support. You're here, you're on the call, so clearly you support what we spoke about today. And so I'm going to invite everyone, the link should be in the chat for you to sign the call to action. Thank you all for being here. As said many times today, this is a movement. We've now looked back. It's time for us to look forward. And we look forward to working together with you to support the mental health of youth in the Caribbean. Thank you so much for being here. Take care, everyone.